Let's learn what an orthopedician wants from a radiologist while reporting a case of an ACL injury. So, whenever we have a patient with a twisting injury or a post traumatic event with bone marrow edema pattern favoring the ligamentous injuries in the form of ACL or PCL injury, so in those cases, what we need to mention in our reports is the status of ligament injury, what is the grade. Apart from that, we need to look at the status of menisci both on the medial and lateral aspect, the articular cartilage, and rest of the structures. So on the medial aspect, we will look at the medial meniscus, which is the most important cushioning agent, the cushioning portion, which is the fibrocartilage. And here we see that there is peripheral longitudinal tear at the meniscocapsular junction at the site of meniscotibial ligament attachment. So this is a ramp lesion, while rest of the meniscus looks perfectly okay. So this area is a hidden portion which has to be seen very carefully on arthroscopy. So it's very important on our part to mention this in our report. On the lateral aspect, when we look at the anterior horn, the body and the posterior horn of lateral meniscus, it looks more or less fine, but when we look very carefully, we should look at the site of Risberg ligament attachment. So this is the Risberg ligament, and when it is attaching to the posterior horn of lateral meniscus, we can see an oblique longitudinal tear at the menisco, at the capsular junction or in the peripheral third, but this is not extending to the body segment. So we will just say that this is a peripheral longitudinal tear in the red zone. Okay, apart from that, the articular cartilage looks absolutely fine. Also, what we need to look is the status of medial and lateral ligamentous structures. The medial collateral ligament is bang okay, while on the lateral side, we need to look at the fibrocollateral ligament, the conjoint tendon with biceps femoris, the popliteus tendon, and the status of iliotibial band. Apart from that, what I mentioned is the status of anterolateral ligament, which is damaged or highly injured in this case.